Sounded interesting that the immune system plays a critical role in the healing response or the possibility of even a detrimental response that can happen to our body. Regenerative medicine, in the context of cell therapies, meaning you have the innate ability. We basically have trillions and trillions of cells in our body, and these cells have the innate ability to do what they did when we were younger or make us live longer, healthier, recover the correct way. Stem cells are basically, you have them in your body. These are a cell type that's as naive and young as you can think. The concept originally was one cell can form multiple cells. One cell can actually form tissue, rebuild tissue, form tissue. And with the years of science and evolution, these adult cells cannot do that.
This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here's your host, Ryan Alford.
Hello, and welcome to Vibe Science. I'm Ryan Alford, your host here. Always try to take you to your highest vibe. It's about mind, body, energy. We might cover all that gamut today because we've got the Chief Development and Science Officer, Dr. Rafael Gonzalez. He's with rehealth.com and ReSTEM.com, a regenerative medicine scientist with 20 years of experience, and I can already tell, a nice guy. What's up, Doc?
Happy to be here. Thank you very much. Pleasure, honor to talk about my passion, purpose, and what I love to do. Actually, if I can impact a life, one life, I've done quite a bit, which is super cool.
I think you're doing more than that, Doctor. And it's a fascinating time to be alive in a lot of ways. There's something meta about that statement and this show and what we're doing. But all the advances that are happening in medicine and technology, and I don't know, it's all right at our fingertips. That's why I like doing this show. It keeps me abreast of all of the latest and greatest things in regenerative health. And you know, I don't love the word biohacking because it feels way more sophisticated than I feel like I am in my approach to health, but I guess in a way it is. But at the end of the day, there's these advances happening and ways to take care of ourselves that awareness needs to be made, needs to happen. You know, people need to know about these things and know what's available to them and, you know, what's kind of happening out there. So I look forward to, you know, kind of taking a macro and a micro view with you, Doctor, about, you know, micro, specifically what you're doing, but maybe getting your macro view on where all this stuff is kind of going and the things that you're learning. So I guess buckle up, everybody. We're going to get rolling. Doctor, I mean, you know, we'll have the Cliff Notes to all your history and everything on the website and all of that. But I think I'd love to start with, where are we at in this field of regenerative medicine? You know, maybe set the big picture to start, and then we'll dial it in to what you're doing with Rehealth and ReSTEM.
Yeah, fortunately, we've been able to significantly grow because it's out there, it's available. There's methods for me specifically. Is the key focus for me is the immune system. I've always focused on that. Many years back when I looked at every single disease and various different diseases, including injuries, trauma, spinal cord injury, which I was part of the Christopher E. Prowse Foundation over 20 years ago. It sounded interesting that the immune system plays a critical role in the healing response or the possibility of even a detrimental response that can happen to our body. And regenerative medicine, in the context of cell therapies, meaning you have the innate ability. You know, we basically have trillions and trillions of cells in our body, and these cells have the innate ability to do what they did when we were younger, or make us live longer, healthier, recover the correct way. There's nothing more important than the immune system. And, you know, even if you think of, people talk about skincare, cosmetics. Listen, the immune system plays a critical role in this stuff too. You look at a sick person, they look sick. You look at somebody that has, you know, high viruses, which is a problem that everybody knows about now, and there's new ones coming in on a daily basis. you look sick, and your skin reflects it. Your skin will reflect this. It's important that everybody understands that. I think, help is on the way. Science is evolving and has evolved a lot. And the good thing about it is that people like yourself and others out there are making the push of how do we make this stuff sort of conventional medicine is one. And then two, how do we make this somewhat affordable or, getting out there? There's quite a bit of advances. Like, for instance, this past year, there was the first approval ever of a stem cell product for a specific disease, which is graft versus host disease. So it's basically when you have a transplant of an organ and your body rejects it. If you use a particular type of stem cell, it stops that rejection. It's a regenerative medicine product, and it works well for that. It's the first of its kind approval, and companies as ourself are now have gone into the immune space a lot, autoimmune disease, and we're hoping by next year we will have some form of maybe a pre-market condition approval or something specifically for specific autoimmune diseases that we can get an approval. And it's one step at a time, baby step of getting these therapies out there, these cell therapies out there.
Yeah. I mean, I think if I was in your shoes, because I know how I am as a businessman, that cares a lot about health and a lot about empowering other people about health and wellness, both alternative and mainstream. I feel like, there's so much change in technology coming like a fire hose. It would be like focusing. Like I would like, I could do this. I could, research that, and we could develop this, or we could do that. Like, how do you focus and, keep your mind and, maybe the company's, vision towards the right things at the right time?
For us specifically is to power forward as a company, as ReSTEM, our U.S. entity, is how do we get to market? How do we get something approved? And when you think of that aspect, you think of orphan diseases. These are diseases that basically are not that, there's not that many people plagued by it. But it enables the opportunity to go quicker to get to market. Once you're at market on the business front aspect of it, then you can broaden the scope of treating other different things. If you look at the properties of, a product, everybody's heard the term stem cells. The problem with this entire sector is, every stem cell is completely different. Because ultimately it depends on, this is why the FDA is actually there to make sure that everything is done correctly. Number one, make sure that you're safe. How do you manufacture these? Not every cell is the same. How do you grow these? When you take pure stem cells, you have to grow them. You have to expand them. And depending on the diet, just like, you are what you eat, the old days, it's the same exact concept of when you feed cells in a petri dish.
Right.
That produces the ideal cell. That is key to producing the ideal, maintaining a young cell. You also don't want, for instance, people talk about, hey, stem cells. Oh, I got stem cells. They took cells out of my bone marrow. They treated me back. Well, guess what? You're getting yourself back, and whatever inherent issues you had, you're getting essentially that back to yourself. Those stem cells are as old as you are. Do you really want that versus something that has been validated, tested, and has a youthful, the phenotype, the physical features of it, the correct mechanism? It's like the same thing as you have a headache and there's an active ingredient. What is the active ingredient in the stem cell? So that's how us as a business, I wish I can target everything. We published a study in heart failure. We're now veering into muscular dystrophy. We're in multiple autoimmune diseases. How do we keep exactly what you said on the business aspect focus? And our focus right now is, one thing which is called inflammatory idiopathic myopathy. It used to be called polymyositis dermatomyositis. It's an autoimmune disease that basically targets skin and muscle, and eventually these patients end up getting self-attack on their lungs. They end up getting pulmonary fibrosis. They succumb to pulmonary fibrosis. It's a pretty bad autoimmune disease. The people are on immunosuppression, just like those commercials you see at night, causes cancer, other different infectious diseases, et cetera, et cetera, et cetera. Exhaust your immune system. That's the only thing that we can do as a team to empower how we get stuff out there.
For someone that's heard of stem cells and the therapies, but I think there's also a lot of mystery around what it is. Doctor, if you don't mind, maybe give us, like, I know it could get deep and complicated, but maybe the 101 of what stem cell therapy is and what it, what it is today and what the potential is.
I mean, the stem cells are basically, you have them in your body. These are a cell type that's as naive and young as you can think. The concept originally was one cell can form multiple cells. One cell can actually form tissue, rebuild tissue, form tissue. And with the years of science and evolution, these adult cells cannot do that. What they found was these adult cells, just like every cell on your body, basically can signal other cells and tell other cells to repair, to do what they need to do to make that change. But ultimately, that stem cell that, for instance, everybody's heard of, you can get these stem cells from bone marrow, you can get them from fat, you can get them from teeth, you can get them post-birth from the umbilical cord, you can get them from the amniotic tissue, from amniotic fluid. It just depends on where they're from is what dictates their properties, or what I always talk about is the active ingredient. What are they there to do? It's just like it's ultimately they're a drug. They're considered in the United States a drug. Outside the United States, they're also dictated as a drug, but the rules and regulations are a lot more lenient with getting approvals to get it done outside the United States. That's why people travel outside the United States, where this stuff is basically not available here the correct way. There are some states that have put in their own rules and regulations, but when you talk about purifying a stem cell, meaning taking it, isolating it, growing it up, it's considered a drug in the United States. It's considered a drug in almost all the states.
Hey, what's up, guys? I used to catch myself doom scrolling Instagram for fitness tips, and honestly, most of it just made things more confusing. That's why I switched to Fitbod. It combines the workout planning and tracking you need to stay consistent and actually make progress. Being able to just open the app, have it ready, and know what I trained last, what muscles need recovery, how much time I have, and what equipment I'm working with. And honestly, it just feels like having a personal trainer right there in your pocket. The workouts have been challenging without burning me out, and they've changed as I've improved. Level up your workout in the new year. Join Fitbod today to get your personalized workout plan. Get 25% off your subscription or try the app free for 7 days at fitbod.me/vibe. That's fitbod.me/vibe. Doctor, I want to get into some specifics of Rehealth and ReSTEM, like other things you guys are doing, but maybe for the audience too. I don't like to go to hypotheticals, but what do you see happening, for people in their 30s and 40s? So let's call it short of an accident or an unexpected help. What's going to happen in our lifetime that's going to just be amazing for all of this type of regenerative stuff? I mean, are we close to unlock? I read these things, you see these things, and it's hard to know what's sensationalized and what's real. I mean, are we knocking on the doorstep of unlocking 30 more years of life?
We're in your lifetime, you will see this. I'm confident you will see this. Possibly in my lifetime too. I mean, I'm 6 years old. Possibly in my lifetime, we will see this too. That quality of life will improve significantly. People will live much longer. The majority of stuff that you see online, if you dig deep, this is stuff that we cured blindness, and it's in a mouse. Let me tell you, I'm a scientist. Worked on a bunch of different animal models, mouse models, rat models. We cure in science. Unfortunately, we learn a lot from this. We cure every disease. I mean, we went from mice with traumatic brain injury to being completely functional, not being able to walk, being completely functional. When you try to translate this, we're not mice. Less than 5% of the stuff that happens in research, doesn't translate into the human condition. It's a small percentage of stuff that actually translates into the human condition. People always have all these crazy findings, but translating that from a mouse to a human being is a different animal. And the years and the research involved in it, because number one is you have to make sure it's safe. Number two is there's some true efficacy there versus a placebo, because the placebo effect is real. I mean, you can discuss the placebo effect on a daily basis with anybody, and you know, it's 100% real. And I'm a true believer of placebo. I mean, I see it with my mom. My mom will call me in the morning, 85-year-old woman, not feeling well, and I'll say, "Mom, did you go outside?" We talked about earlier. Did you go outside and expose yourself to sunlight? Did you do your breathing exercise this morning? She's 85 years old. Please do your breathing exercise. Please go outside, expose yourself. Please touch your feet on the ground outside. Let's talk again in 25 minutes. It's night and day, person. It's the correct method of, and these are all simple, what you said earlier. We were talking about biohacking. Biohack yourself. That costs you, doesn't cost you a dime to make your day 100% better.
I'm talking with Dr. Rafael Gonzalez. He is the Chief Development and Science Officer for rehealth.com. What's got you excited with Rehealth and ReSTEM? You talked a little bit about it, Doctor, but where are we going? What's coming? What are we working on today?
We're working on some neat things. We're a cell therapy company. U.S., we have multiple clinical studies in autoimmune diseases. We're actually going into the longevity space with a different, not even a stem cell. We'll talk about that in just a second, which is a particular cell called the natural killer cell. And just like it's named, the natural killer cell is a cell in your body that is an amazing cell. It's one of the first responders in many things in your body. And we've licensed our technology here in the United States to a ex-US company called Rehealth.com that helps individuals that need these therapies now, which makes it a neat opportunity. But that natural killer cell for me is the future of medicine. It's the cell in your body that you'll start hearing more and more about. It's in charge of three things. One is a mutated cell, cancer. It's the first responder to it. Two is viruses, one of the first responders to this in your body. And then three, what we're targeting is senescence. People are like, what the hell is senescence? I haven't heard of this.
Mm-hmm.
It's a zombie cell. It's an old cell. We call it a zombie because what do zombies do? They walk around causing havoc in your area. And then once they bite somebody, you become a zombie. Similarly, this cell in your body, this senescent cell in your body, what it does, it's a cell that has stopped duplicating, stopped dividing. And think of wrinkles of skin, gray hair, you lost the melanin, fibrosis of the lung, cells are no longer functioning correctly, just occupying space and causing havoc. These cells basically communicate with its surrounding, these senescent cells, with its surroundings, and convert them into other zombies. Believe it or not, it's pretty crazy. It makes them old, makes them cause
The Walking Dead
too.
inside of us.
The Walking Dead are in our body, are inside of us.
Yeah.
And it happens with aging. With aging, it happens. And we can eliminate these in the immune system because it happens in your immune system. The concept is simple. You eliminate this senescence, these zombie cells in your immune system. Your immune system has to naturally regenerate by signals in there. We're missing cells in our body. Let me produce young progeny. Let me produce young cells to come out to our immune system and not function correctly. We published a paper on this in 2022, and it seemed to work, really well, which we're moving forward in the longevity sector of looking at, the context of clinical studies in the United States. You have to go with defined medical terms. Defined medical terms in aging are frailty and sarcopenia. Other ones are post-chemo, post-radiation. From doing chemo and radiation, you get buildup of these senescent cells. There's evidence out there, scientific evidence, that transpires because you're wiping out cells, good cells in your body. And that transpires. How do we eliminate that, clean and flush it out? Sort of like an oil change, a tune-up. How do we flush that out and give the system its own innate ability to heal? And that's the neat stuff that we're working on now, that we've been working on for many years.
it's, I don't know, it gets me excited about the future and what we're going to be seeing. Cause like, it makes sense to me, just when I hear you talk about it, like the way these processes work. There's a lot of complexity in it, but I think it can be simplified in a way so that people understand it. And then to have access to these products affordably, even if it's, I mean, I say that word and I kind of pause, doctor, because I'm always like, if you aren't alive, why do you need to save money? Like, it's like, I get that some of these things are rid of it, but like, what's more, investing in our health is the most important thing we can do, because none of it matters if you don't have health. It's so funny to me
100%.
what people save money on, like, because if you have a sore throat and you're in bed, nothing in the world matters until that's gone. And so there's some irony there. And I don't say that like lightly, like, well, we can all just go, have $100,000 stem cell therapy or something, without insurance help. But I think you get the point and probably agree with it.
Yeah, 100%. I mean, the concept is to get this stuff approved so insurances can cover it is one. Two, we ourselves also have a platform called Horizons Program, where for those that can't afford it and want to go do this outside, we will gather if you're sickest, if you have all these medical issues, if you're deemed a candidate and, you have financial need, we can help you there too. It's all about how do we help many people out there? How do we find out what works, what doesn't work? And then translate that here to clinical trials, the possibility of getting approvals later on down the line in multiple different diseases. So it's what we've done in an effort to try to get this out, to as many as possible and make it supportable.
We got to get rid of those NKCs, baby.
No, you got to get those activated in your body.
Yeah, get them activated. You got to get down with activated. NKC. You know me. We'll go the other way.
Yep. Yeah, you got to get those activated, and you got to get those to be they're young killers.
So that they're inside, so you don't have to get them injected, right? Because if you get those activated, then you don't have to go do with the stem cell thing, right?
Well, you got to get them. You got to get them activated in your body. There's not too many methods of doing so within the body. But if you take them out from you, what we do is take them out from you, take blood out, purify them, activate them, grow them, produce billions of them, then put them back in their younger active form. The way this is done. We're working on off the shelves specifically too, where you're not forced to take blood out, activate, grow, because that becomes a really expensive process. To try to get this out to the masses is, how do we produce one that all I'm doing is taking something off of a shelf and using it on multiple individuals for senescence, for these zombie cells to eliminate them.
Yeah. I've read about the zombie cell thing. It's a proper name for them. They're like,
it's an easy term.
They're just, and they're kind of waiting around, right? Like, or stumbling around. You don't know what they're kind of like, you don't know exactly what's going to get activated.
Exactly. Yeah. Before it was thought that, the body, it was thought of a mechanism of how do you stop proliferation of cells? How do you stop cancer? You think overproliferation is cancer. It was thought of this is your inherent mechanism to stop cancer. There's now a significant amount of research and evidence that no, these cells actually cause cancer because they cause havoc. They release like this communication skills to surrounding cells and cause, havoc. In Petri dishes here, we do these neat experiments where we put these senescent cells in with young cells. And what we essentially get with time is, believe it or not a rescue of that old cell, but actually the old, not a rescue of the old cell to become young, but the young cells become old. So it's something that's, that we're focused on, that we're, essentially improve the immune system and you're going to live longer and healthier.
Where can everyone learn more about what you're doing, doctor, what everything that's happening at rehealth.com and restem.com?
Either one of those websites is simple. They can also reach out to the info parts of it. We're all open to, we send, multiple to different publications, different work. They're on the sites, actually both on the sites there. Reach out, inquire if you have health issues, like I said. we're completely open with, how can we help? What can we do? I'm sure I know we have social media also that can be looked at. Tags. Mine is Dr. Gonzalez, PhD. You're welcome to, I'm always trying to help whoever I can as much as possible. How can we do that? But, we talked about earlier, what are the simple baby things of changes that you can make, the biohacking, as you would say. There's a ton of them. There's a ton of free ones out there that you can do. And the placebo is the placebo, but I believe in the placebo.
Doctor, really appreciate your time, and thank you for coming on the show.
Thank you very much for having me, and anything I can do, I'm here to help. Blessed to help.
Hey, guys, you want to find us, vibescience.com. We'll have the full episode, highlight clips, and links to everything that Dr. Gonzalez mentioned, rehealth.com. You can hear me say it, but we'll have a link there. All you got to do is click it, go learn more about what they're doing there and at ReSTEM, and we appreciate you for tuning in. We'll see you next time on Vibe Science.
The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe.